Osteonecrosis of Femoral Head, or ONFH, is a progressive hip joint disease with no consensus on effective treatment. Left alone, the disease can ultimately lead to total hip replacement. Serum amyloid A is an acute phase response protein that is an inflammatory marker. While there may be a correlation between serum amyloid A and ONFH, it is poorly known. In a study published in Frontiers in Pharmacology, researchers explored the role of serum amyloid A in bone metabolism to enrich research on the mechanisms of ONFH. To investigate the effect of serum amyloid A on the serum of ONFH patients, the blood of ONFH patients and healthy controls was obtained and their sera was isolated. Through proteomic analysis, the protein profiles from the sera were analyzed using two-dimensional gel electrophoresis and silver staining. The spot patterns of the gel images were then matched. In an in vitro experiment, rat bone mesenchymal stem cells were obtained from male rats. BCIP/MBT staining was then used to evaluate the effect of serum amyloid A on osteogenic differentiation in these rat bone mesenchymal stem cells, and oil red O staining was used to detect the effect of serum amyloid A on adipogenic differentiation. In an in vivo experiment, 15 12-week-old rats were obtained to test the ability of serum amyloid A affecting bone metabolism. Two critical-size circular bone defects were created to both parietal bones bilaterally. New bone formation and mineralization was observed by injecting the rats with fluorochromes. Of the spots observed in the silver-stained gel, spot number 21 corresponded to an upregulated serum amyloid A in patients with steroid-induced ONFH. Results of the BCIP/MBT staining revealed that rat bone mesenchymal cells treated with serum amyloid A had minor mineralization compared to rat bone mesenchymal stem cells without serum amyloid A. Oil red O staining showed that the number of stained lipid droplets was significantly higher in the rat bone mesenchymal stem cells treated with serum amyloid A. These findings provide more information on the correlation between serum amyloid A and ONFH and illustrate that serum amyloid A is vital to the physiological process of ONFH and can act as a potential therapeutic target to treat it. Anogen serum amyloid A ELISA kit was used in the study for the purpose of quantitatively validating the serum level of serum amyloid A, allowing the researchers to come about the breakthrough discovery that serum amyloid A is increased in the serum of ONFH patients. Anogen is willing to provide hundreds of high-quality antibodies and ELISA kits to support continuous advancements in biomedical research. For more information, please visit Anogen's website at www.anogen.ca.